Hello everyone, myself Sujatajha, and today we will be discussing about none other than glaucoma. Let's begin with the topic objectives, introduction, definition, incidence, etiology, pathophysiology, classifications, clinical manifestations, diagnostic evaluations, and nursing management in geriatric patient or normally in everyone. So firstly, what is glaucoma? Glaucoma is a disease involving the loss of retinal ganglion cells. It is the most important thing that it involves the loss of the retinal ganglion cells. So basically, it greatly affects the function and condition of the optic nerve, and the patient may end up having visual field loss and permanent optic nerve damage. So glaucoma refers to a group of ocular disorder. It doesn't have particularly a single disorder, but it refers to a syndrome of ocular disorder characterized by increased intraocular pressure, optic nerve atrophy, and peripheral visual field loss that leads to damage to the optic nerve. So basically, these are the group of ocular disorder that manifest glaucoma or precipitates the glaucoma. Glaucoma is the third leading cause of the blindness. As we know, the normal pressure or normal ocular pressure is 12 to 22 mm of Hg. Next is increased intraocular pressure results from inadequate drainage of aqueous humor from the canal of spleen, raised pressure in epicleral veins, or overproduction of aqueous humor. Firstly, glaucoma is related to the intraocular pressure, and intraocular pressure is related to the drainage of the aqueous humor, and the drainage of aqueous humor takes place from the canal of spleen. So these are the things that are over connected with each other. Nextly, the pressure of ocular hypertension alone does not establish the diagnosis of the glaucoma. As we previously discussed that glaucoma is precipitated or consists of a group of the ocular disorders. So, a pressure of ocular hypertension alone does not establish the diagnosis of glaucoma. Two out of the following three criteria usually are required to establish a diagnosis of glaucoma. That includes elevated intraocular pressure, visual field loss, and damage to the optic disc. So, out of these three, the two of the following criteria are usually established for the diagnosis of the glaucoma. So, this is a pictorial diagram. We can see to establish glaucoma, there must be ocular hypertension, then after discopy and visual field damage. So these are the things. If these things are established, then the glaucoma gets established. So it gives us the pictorial representation of the criteria for the glaucoma. Etiology. The main cause is idiopathic. Predisposing and risk factor includes hereditary, age 50 to 70 years of age, high myopia, diabetes, one of the most preferable cause or more prevalence, smokers, hypertensive, long-time steroid user, history of previous eye surgery or trauma. So these all came from the resources, or these all were the high incidence for the glaucomic patients. Pathophysiology or physiology of glaucoma. Firstly, clear liquid called aqueous humor circulates inside the front of the eye. As we already knew, it is related to the aqueous humor. To maintain a healthy level of pressure within the eye, a small amount of aqueous humor is produced constantly. Firstly, to maintain a healthy level of eye, it is necessary to produce a small amount of aqueous humor, which is produced constantly, while an equal amount flows out of the eye. So it is balanced. The amount that is produced and the amount that is drained out are equal, so that there maintains an equilibrium status. While an equal amount flows out of the eye through a microscopic drainage system, the trabecular meshwork. So, as we know the drainage, there must be a drainage system. The drainage system is termed as the trabecular meshwork. With glaucoma, aqueous humor does not flow through the trabecular meshwork properly. So, here is a condition. In the glaucomic patient, the aqueous humor does not flow through the trabecular meshwork properly. Over time, eye pressure increases, damaging the optic nerve fibers. So, firstly, aqueous humor is produced normally and it gets drained out normally in the same amount, but with the glaucoma, the aqueous humor does not flow through the trabecular meshwork properly, ultimately leads to the ocular hypertension. Very shown as the cornea iris fluid from which flows from the posterior region of the Now you can see that the iris, then after normally fluid exists here through the trabecular meshwork. Firstly, the fluid is produced ahead of the iris and then it is flowed. Yes, and those are the retina and optic nerve. So intraocular pressure is a function of production of the liquid aqueous humor by a ciliary process of the eye and its drainage to the trabecular meshwork. Okay, first of all, glaucoma is established with the ocular hypertension. Ocular hypertension is caused due to the inadequate flow of the aqueous humor through the trabecular meshwork. And ultimately, intraocular pressure is a function of production of liquid aqueous humor by the ciliary process of the eye and its drainage. So intraocular pressure basically means the proportionate or equilibrium between the production and uh, drainage of the aqueous humor through the trabecular meshwork. Aqueous humor flows with the ciliary process into the posterior chamber, bounded posteriorly by the lens and zonules of Zinn and anteriorly by the iris. So, as we know, the aqueous humor flows through the ciliary process, right, into the posterior chamber, bounded posteriorly by the lens. You can see here posteriorly bounded. Okay, posteriorly bounded by the lens and zonules of Zinn and anteriorly by the iris. So here anteriorly it consists of iris and posteriorly zonules of Zinn. It then flows to the pupil of the iris into the anterior chamber, bounded posteriorly by the iris and yeah. So these you can relate in the figure by self-observing the figure. These are the most important factors regarding the ocular or intraocular pressure. From here, the trabecular meshwork drains aqueous humor by the sclem canal into the scleral plexus and general blood circulation. In open-angle glaucoma, there is reduced flow through the trabecular meshwork. So, firstly, it then flows to the pupil. First of all, intraocular pressure is the production of liquid aqueous humor by the ciliary process. Then aqueous humor flows from ciliary process into the posterior chamber. Okay. Then, after, it flows through pupil of the iris into the anterior chamber. The main thing is firstly it flows through the ciliary process into the posterior chamber, then it flows through the pupil of the iris into the anterior chamber. From there, the trabecular meshwork drains the aqueous humor by the sclem canal, then it gets drained into the sclem canal into the scleral plexus and general blood circulation. Okay, in open angle glaucoma, there is reduced flow through the trabecular meshwork. Okay, there are two types of glaucoma. We will discuss further, but for a bit of slight information, in open-angle glaucoma, there is reduced flow through the trabecular meshwork. In angle-closure glaucoma, the iridocorneal angle is completely closed because of forward displacement of the final roll and root of the iris against the cornea, resulting in the inability of the aqueous fluid to flow from the posterior to the anterior chamber and then out of the trabecular meshwork. So basically what it is trying to say is in angle-closure glaucoma, the angle between the iris and cornea gets decreased, that is iridocorneal angle gets decreased, due to which the aqueous humor cannot flow out from the posterior to the anterior chamber and then out the trabecular meshwork, due to which the intraocular pressure gets increased. So this is the pictorial diagram. Here it is inflow, normal and outflow, but in glaucoma condition, inflow, there exists inflow, but the outflow is diminished. The outflow of the aqueous humor through the trabecular meshwork is decreased. Ultimately, there is increase in the intraocular pressure. Primary or secondary. According to anatomy of the anterior chamber, open angle or angle closure. According to the natural history, acute or chronic. According to the age of onset, congenital or developmental, which is also called as adult glaucoma. Primary open angle glaucoma. We also called wide angle glaucoma. This is the most common type of glaucoma. The structure of the eye appear normal. So this is the basic characteristics. The structure of the eye appear normal, but fluid in the eye does not flow properly or slow through the drain of the eye called the trabecular meshwork. It is a multifactorial disorder that is often genetically being lost. So in primary open angle glaucoma, what happens is the structure of the eye remains normal, but the fluid in the eye does not flow properly or slow through the drain of the eye called as a trabecular meshwork. Now, primary angle closure glaucoma, PACG, also called acute or chronic angle closure or narrow angle glaucoma. This type of glaucoma is less common but can cause a sudden buildup of pressure in the eye. This is less common, but it can, however, cause a sudden buildup of pressure in the eye. Drainage may be poor because the angle between the iris and cornea, that is to say, iridocorneal angle, where a drainage canal for the eye is located, is too narrow, or the pupil opens too wide, narrowing the angle, blocking the flow of fluid through the canal. So basically, what is the main difference between POAG and PACG is, in POAG, it is due to the inadequate flow of the aqueous humor, right, from the trabecular meshwork, basically defect in the trabecular meshwork or blocking of the trabecular meshwork. Whereas in primary angle closure glaucoma, what happens? There is decrease in the iridocorneal angle, due to which ultimately the intraocular pressure gets increased. Okay. Drainage may be poor because the angle between the iris and cornea is too narrow, or the pupil opens too wide. So basically, if the pupil opens wide, then iridocorneal angle gets decreased, narrowing the angle and blocking the flow of fluid through the channel. The next is secondary glaucoma, may occur as a result of trauma that can disrupt the flow pattern of the aqueous humor. It may be associated with inflammatory condition, ocular neoplasm, and trauma. So basically, it is due to the trauma, like different kinds of external mechanical factors or various kind of accidents. They cause the secondary glaucoma. So, firstly, primary open angle glaucoma is due to the inadequate flow of the aqueous humor through trabecular meshwork, whereas primary angle closure glaucoma is due to the decrease in the iridocorneal angle or overdilatation of the pupil. The next is secondary glaucoma caused due to the result of trauma, which affects the flow of the aqueous humor. Signs and symptoms includes gradual loss of peripheral vision, usually in both eyes. Important factor to note is loss of peripheral vision and tunnel vision in advanced stage, mild discomfort in the eyes, halos around the light, no pain or pressure. The patient does not notice the gradual visual loss. Symptoms of acute angle glaucoma. Chronic angle closure glaucoma, it includes hazy or blurred vision, sudden slight eye pain including eyebrow, halos around light, the appearance of rainbow colored circles around bright light. If we suddenly observe bright kind of light, then sometimes we tend to see the different rainbow colored circles. So in glaucomic patient, it appears in a regular interval. Then the next is acute exposure glaucoma sign and symptoms, which include severe eye pain, nausea, vomiting, sudden onset of visual disturbance, often in low light. Mark to be noted, that is often in low light, blurred vision or cloudy vision, halos around lights, reddening of the eyes. But the reddening of the eyes is different from the other kind of ocular diseases. Sudden slight loss, progressive loss of central vision, vision worsening in evening with difficulty adjusting to the dark light, photophobia, lacrimation, or frontal headache. So these are the symptoms of acute angle glaucoma in chronic and acute. So let me tell you the difference. In acute conjunctivitis, you can see the reddening in the corners of the eye, that is in the peripheral regions, whereas in acute glaucoma, the reddening of the eye includes all surface of the eye, whereas at iritis, it is mainly focused towards the lens and it gets faded in the peripheral areas. So these are the difference between the reddening of the eye in acute conjunctivitis, glaucoma, and iritis. Hope you got it. And the difference between tunnel vision and peripheral vision is this. Tunnel vision appears as seen in the picture. Now, diagnostic evaluation. So, diagnosis is usually, firstly, it is a diagnosis based upon history and physical examination, that is ocular examination, visual acuity test, tonometry, which is done for the measurement of the intraocular pressure, tonography for the estimation of the resistance in the outflow channels by continuously recording the intraocular pressure over 2 to 4 minutes, visual field perimeter, measurement of visual function in the central field of vision, ophthalmoscopy, evaluation of color and configuration of the optic bulbs, optic disc examination, gonioscopy, which is for the examination of angle structure of the eye, that is iridocorneal angle, and fundus angiography. So these are the diagnostic evaluation done for the diagnosis of the glaucoma. Next is medical management. The goal of the treatment is to keep the pressure low. As we know, the major prime component for the cause of the glaucoma is intraocular pressure. So the goal of the treatment is to keep intraocular pressure low enough to prevent the patient from developing optic nerve damage. Treatment includes drug therapy. Eye drops are most common treatment. It includes myotic drop, pilocarpine 1%, 2%, and 4%, beta-adrenergic blocker eye drops, which includes timolol, iotine, betaxol, tap acetazolamide 250 mg, 2000 mg in divided dose. Acute angle closure attack is a medical emergency. Blindness will occur in few days if not treated. Okay, the medical emergency is for the acute angle closure glaucoma. The next is eye drop, medicine to lower eye pressure given by mouth and through a vein by tongue. So these are the medical management. The next is drugs used in glaucoma. So firstly, to increase the outflow of the aqueous humor, which is called as myotic. The myotic increases the outflow of the aqueous humor, right? The second is decrease the production of the aqueous humor, and the third is inhibits the carbonic anhydrase. So these are the conditions that precipitate glaucoma, and we use drugs for these precipitating factors. So firstly, myotic drugs, we use pilocarpine 1%, 2%, and 4%. Works within 10 to 30 minutes for 4 to 8 hours. Indication glaucoma. Dose 1 to 2 drops. Frequency 3 to 6 times a day. Okay. So these are all about increasing outflow of the aqueous humor. The next is decrease the production of the aqueous humor. Timolol 0.25% to 0.5%. It is a beta blocking agent. It decreases the intraocular pressure, acts within 20 minutes for 1 to 2 hours. Indication, it includes chronic open angle glaucoma. Dose 1 drop BD, that is 2 times a day. And the other symptoms, or we can say that the contraindication includes hypersensitivity to the composition, bronchial asthma, COPD, chronic cardiac failure, or any heart problem. The next is inhibiting the carbonic anhydrase, which includes acetazolamide. It is used to inhibit the carbonic anhydrase, which decreases the formation of hydrogen and bicarbonate in aqueous humor and water secretion in it. It acts within 1 hour and persists for 8 to 12 hours. Indication, chronic open angle, secondary and angle closure glaucoma. Doses 250 to 1000 mg per day in divided doses. So these are the drugs used in glaucoma, divided in 3 different categories. First one, to increase the outflow of aqueous humor, which is used for the myotic. Second, decrease of aqueous humor production. Third is inhibiting the carbonic anhydrase. Surgical management. If the medical management fails, or if the medical management cannot be carried out or doesn't respond, then surgical intervention is required. It includes as a trabecular plasty, is a therapeutic treatment to lower the intraocular pressure when medications are not successful. Trabecular plasty may be done if the medical and laser therapy is not successful. Iridectomy for angle closure glaucoma. So these are the surgical interventions. Nursing management, the prime component. Firstly, nursing assessment, history collection and physical examination, access the signs and symptoms of intraocular pressure and glaucoma. This is the nursing assessment. Then nursing diagnosis. Various nursing diagnoses can be formed, but I have kept these diagnoses. So first is acute pain related to pathophysiology process and surgical correction. Disturbed sensory perception related to the visual impairment. Anxiety related to changes in the health status, presence of pain, possibility of visual loss. Risks for injury related to the visual acuity deficits. Self-care deficit related to the visual acuity deficit. Non-compliance related to the inconvenience and side effects of glaucoma medication. You can formulate many other diagnoses based upon the NANDA diagnosis. Okay, coming to the nursing management. First, administer medications as prescribed. Provide quiet and dark environment to reduce the irritability to the eyes. Apply cold compress in forehead as increased ocular pressure causes headache. Maintain accurate intake and output with the use of using osmotic agents, so it is very important to maintain intake and output. Next is prepare the client for the surgery if indicated. Provide client teaching. Now the nurse should provide teaching on various aspects related to the disease, but as we are discussing for the ocular, that also glaucoma. So these are the teaching we should provide to the client. First, self-administration of eye drops. As the patient is not as the patient doesn't need to stay in the hospital for a very long time, so we should teach them about the self-administration of the eye drops. Need to avoid stooping, heavy lifting or pushing, emotional upsets, excessive fluid intake, and constructive clothing around the neck. So these are the activities or these are the factors that may exaggerate the condition. So we need to tell them to stop this kind of activities. We need to convince them to avoid the use of antihistamine or sympathomimetic drugs which is found in cold preparation in closed angle glaucoma since they cause the mydriasis. So one of the most important teaching is to avoid the antihistamines or sympathomimetic drugs. They can cause the mydriasis. Okay. Importance of follow-up care. Need to wear medic alert tag. So it is one of the important factor that we need to wear the medic alert tag that may help other people understand the conditions and help you to get the proper treatment rather than that of the wrong treatment. So these are all about the glaucoma. So let me give you a short summary. First of all, glaucoma is caused due to the raised intraocular pressure, which is caused by different kind of factors, but the main is due to the inadequate flow or drainage of the aqueous humor through the trabecular meshwork. It has various etiological factors, which includes diabetes mellitus. So this was all. Thank you very much.